Cardiopulmonary arrest is a life-threatening condition that occurs when the cardiac contractility and spontaneous respiration cease. It represents a medical emergency, as even a brief period of 3 to 5 minutes of circulatory arrest can lead to irreversible brain damage. The consequences of a cardiopulmonary arrest are profound, underscoring the critical importance of prompt diagnosis and intervention for a positive outcome. Diagnosing cardiopulmonary arrest is typically evident, involving the assessment of multiple factors. Neurologically, is often characterized by an apparent state of death, a sudden loss of consciousness. From a circulatory standpoint, it is defined by the absence of any carotid or femoral pulse, while on the respiratory front, it is marked by the cessation of ventilation or respiratory movements, often associated with skin pallor. Various and specific mechanisms can contribute to the condition, including ventricular fibrillation, which causes uncoordinated quivering of the ventricle with no useful contractions. VF leads to immediate syncope and death within minutes and may manifest in the ECG with rapid and chaotic activity with broad polymorphic QRS complex. Ventricular tachycardia, defined as 3 or more consecutive ventricular beats at a rate of 120 beats per minute or higher, may present with symptoms ranging from none to palpitations to hemodynamically collapse and even death. Diagnosis is made by the ECG showing a large and regular QRS complex. Additionally, asystole, indicating insufficient heart contraction, present on the ECG with a flat trace. Finally, electromechanical dissociation, characterized by the absence of mechanical activity in the heart, despite the presence of electrical activity, may show a wide or no QRS complex on the ECG. Furthermore, numerous underlying causes can trigger cardiopulmonary arrest, encompassing cardiac issues such as coronary artery disease and valvular pathologies, respiratory problems like severe asthma and foreign body obstructions, as well as pneumothorax, neurological factors due to the depression of our respiratory centers, and circulatory problems like pulmonary embolism or shock, metabolic imbalance including hyperkalemia and metabolic acidosis, as well as various other conditions like severe trauma, electrocution, and the hypovolemia, which is a low blood volume resulting from severe bleeding, hypothermia or dangerously low body temperature, usually below 35 degrees, and hypoxemia, which is a low blood oxygen level. Detailed management of cardiopulmonary arrest will be discussed in another video. Hope this video was helpful to you, and don't forget to like it and subscribe to the channel. Thanks for watching, and I'll see you in the next one.